In an island of our size, with our specific geographical character, there are few suitable sites large enough to accommodate our new hospital. Our planning framework, highway networks, and island infrastructure are such that on many sites our new hospital cannot be delivered without significant challenge. Our hospital political oversight group therefore set out to identify the most appropriate site that has the greatest likelihood of delivering within the time frame and criteria set out in R54 2019. This report outlined our desire to design and deliver a completed hospital in a similar timescale to that of the previous scheme, by the end of 2026. A thorough site selection process was developed and applied to the most comprehensive long list of potential sites. This long list of sites has then been evaluated according to a set of extensive criteria developed and agreed by clinicians, healthcare professionals, a citizens panel of islanders, and technical advisors. As such, this process ultimately resulted in a final shortlist of 2 sites, Overdale and the People's Park. Taking that into account, together with all of the clinical, locational, environmental, design, economic, financial and social impact of the new hospital on the final 2 sites, the Our Hospital Political Oversight Group and the Council of Ministers have determined to recommend to the states that Overdale is approved as a preferred site for Jersey's new hospital, and accordingly, sir, a proposition is being lodged today to reflect that decision. In reaching the judgment that Overdale should be recommended as the preferred site, the Political Oversight Group, sir, and the Council of Ministers have extensively deliberated upon the opportunities and risks involved with each site in reaching this conclusion. We have considered, sir, that Overdale would provide a better integrated hospital design that could support current and future generations of islanders, as the Overdale site is of sufficient size that it can accommodate all clinical services, sir, including mental health, on one site. The site provides sufficient scope to allow for flexibility in design and to respond to the need for expansion in the future. Furthermore, this single site solution will also reduce operational running and logistical costs. Overdale can deliver our hospital in the anticipated project timescale, and Overdale offers a better option in terms of flexibility of design and future-proofing. Whilst a more complex land assembly programme would be required, the impact of the acquisition of private property and impact in nearby residents is limited. The access challenges, which are all duly acknowledged, can be overcome and provide opportunities to improve the road networks and to support wider health and well-being activity. And I think it's important at this stage to briefly touch upon a key concern relating to the access to the preferred site. And I'm pleased to report today that the proposed access solution to Overdale can be achieved without the need to impact upon the residents of the King George V cottage homes. Any additional cost of the new hospital at Overdale when compared to People's Park can be outweighed, sir, by its contribution to the long-term health and care outcomes of islanders over its lifetime. Overdale is a more deliverable scheme given the significant political challenges due to an existing state's decision that the new General Hospital should not be located at People's Park or Victoria Park, sir, in order to retain these valuable open green spaces for St Helier residents and indeed all islanders. Islanders and members will be able to see for themselves later today when this full site valuation report is published as an appendix to the report and proposition just how detailed the process and extensive technical assessments have been to reach these validated and thorough conclusions. To assist members between now and the debate on November the 17th, an extensive engagement plan has been created to provide the necessary detailed information to support members as part of that decision-making process. And I will be writing to members this week, so with a proposed timetable in order to achieve this. In addition, all information provided, sir, will be in the public domain to enable islanders full access. When we set out on this journey, we gave a guarantee to islanders that we would not repeat the mistakes of the past, and specifically, we would not interfere with the site selection process. We have kept to that promise, at each stage allowing the process to follow its course, regardless of how controversial or unpopular the outcomes. In just 10 months, we have undertaken an extensive search and technical assessment process in order to deliver the preferred sites on schedule. In lodging this proposition today, we hand over the responsibility to the States of Jersey, together with the opportunity to deliver our hospital on the back of a our citizens. And I would like to take this opportunity, sir, to thank them all for their very valuable contributions to date. So, to conclude, if approved, Overdale will be set in an elevated, peaceful location and natural environment, close to town, with incredible sea views, offering individual recovery rooms, alongside state-of-the-art and flexible modern medical facilities and technology. Patient experience will be paramount, meaning we will be able to attract the very best in healthcare professionals, providing the highest standards of care for future generations of islanders. I ask today, sir, that the Assembly unite behind this great responsibility that is now in their hands, and that we work together to ensure no further delays or disruption, but instead look to maximise the tremendous opportunity that this proposal provides. Thank you.
Thank you very much, Deputy Chief Minister. There is now a period of 15 minutes of questions. First question is Connie Tarpson.